Okay, well, I'm sure that people are still joining us. We have quite a number signed up for today's session. It is being recorded, and we will share the session with everybody who signed up for it after the session is done. So good afternoon, everybody. My name is Jo Louise Huck. I am the program director for the Precision Health program at the University of Calgary, the Cumming School of Medicine program, and this is an information session about the program. If you're considering applying to us, we have some information about processes around that, and quite an interesting session, we hope. Joining me is Ivy Young. She's our program manager. Thanks, Ivy, for waving. And Ali Kiani, he is our graduate admissions program person who helps with all of the coordination of the admission processes for our program. So each of them is going to be speaking a little bit as we go through this session. And what I would like to do first, at the University of Calgary, we'd like to acknowledge the territories upon which we live, work, and play. I'm going to hand over to Ivy right now to do the territorial acknowledgement and a few intro slides, and then we'll get more into the details about our Precision Health program. So Ivy, over to you.
Hi, everyone. Thanks so much for taking the time to join today. We wanted to start off in a good way by acknowledging the traditional peoples who've occupied this land for thousands of years. The University of Calgary is located on the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary is also home to the Métis Nation of Alberta Districts 5 and 6. We'd love to hear from you, so please in chat, let us know where you're connecting from today. And if you know your traditional territories and peoples or the traditional languages, please go ahead and also share those as well. And if you aren't sure what they are, check out native-land.ca at some point. You can type in your city and it will name your traditional territories and languages. Take a look at the chat here. See where you're connecting from today. Please go ahead and let us know. We know you're connecting from all over today, so love to see that. And I know you're probably eating lunch as well, doing double duty. So yeah, it's great to see that.
Our first person, brave enough Calgary, a number of Calgary people, Ivy, coming on board. Wonderful.
Okay,
thank you for sharing where you're connecting from. And Ivy, I'll just advance to the next slide.
Perfect. Thank you. So here's our agenda today. We're going to be briefly chatting about what is precision health. You'll have an intro to the program. We are going to talk about the options that you can choose from for your first year, our 4 specializations, and then a few slides that Ali will be covering on how to apply, the awards that are available, and next steps. And at the end, we'll have a Q&A, so you can post your questions in the Q&A panel throughout. And next slide. So we wanted to just start out with a quick icebreaker. So go ahead and post in chat again your thoughts about this. And we're just brainstorming here, so all thoughts are okay. What words come to mind when you hear the term precision health? So one of the things you'll learn about our online program is that we really want to hear your voice. We know you bring a lot of experience and expertise to the program. So please go ahead and post in chat. So thanks for starting us off. I see epigenetics and genetics. Great. Thanks, Franny. Innovation, holistic approach to care. Wonderful. Quality of health services, personalized care. Okay, keep those thoughts coming, and I'm going to pass the mic back to Jo Louise.
Wonderful. Thank you, Ivy. So I'm actually pleased to see some of the words that are falling into the chat, because these are terms that we would associate with precision health. And we like to start this presentation off with our program level definition for both precision health and precision medicine. So these, recognizing that precision health and medicine is a new field, it's an emerging field in healthcare, rapidly emerging. We note that these definitions are there's not one definition that is accepted yet. But these are the definitions that we use for our program. So we are the Precision Health program. This is a broader umbrella definition. Precision health is really about new approaches to the way healthcare is delivered, tailored to patients' genetic, environmental, and lifestyle factors, and often informed by analysis of large data sets. And that's actually quite important. Everything we do in precision approaches is really informed by large data sets. Precision medicine is a subset of precision health. And precision medicine is a direct application of big data, molecular biology, and computational tools in the clinical context. So precision health is broader. Precision medicine is more the clinical medical application. And our program is designed to deal with both precision health and precision medicine. I also note that some people noted innovation is a part of precision. That's absolutely true. Personalized care, absolutely true as well. And on the personalized care piece, we just want to frame the idea that precision health is part of healthcare or health systems evolution. Back when healthcare was sort of beginning organized, clinicians and health professionals really entirely were dependent on their own individual clinical judgment, and we call that intuitive medicine. That's where we started in medicine many, many, many years ago. Over the last 40 to 50 years, evidence-based medicine has been the next evolution of medicine. And evidence-based medicine really is a movement that's dependent on or relies on evidence generated from randomized controlled clinical trials to help inform clinical practices and our approaches to helping patients. Precision or evidence-based medicine has been very, very helpful in terms of improving the quality and the safety and delivery of care. What we're recognizing, though, is evidence-based medicine speaks at an aggregate level. And it doesn't actually help us do personalized medicine. And that's where precision health comes in. Precision health is really about individual diagnoses and treatments through omics and data utilization. Precision health can be applied at an individual level. It can also be applied at a community level or a group level. But the point is, we are being more precise about the individual or the groups that we are treating, and our interventions and our ability to diagnose and predict should be improved as well when we take a more precise approach. The precision health evolution should be leading towards what we hope is a P4 medicine, which is really more accuracy around how we predict, prevent, personalized medicine, and how citizens and patients can participate in medicine. So this is an ongoing evolution. One of the differences with the precision health evolution of healthcare systems is that it is at the speed at which research is happening, innovations are coming forward, and the speed at which people want to introduce precision into their different medical approaches and clinical approaches. So it's a rapidly emerging field, and our program itself is designed to fit in that space. So I just want to shift into a little bit of a discussion about what our precision health program is about. We're going to start with a high-level description of what it's about, give you some information of the program, a little bit of history, and then we'll dive into our program options and detailed specializations. Again, if you have any questions as I'm going through this material, please just put your questions into the Q&A section of Zoom, and we will address them at the end of the presentation. So let's talk about the Precision Health Program. Our vision for the Precision Health Program is we are, with our students and instructors and faculty and community partners, leading the future of healthcare innovation. The program is specifically designed for academic and clinical integration. So we are connected to the clinical world, and we are connected to the academic world, and we're also connected to the world of people and citizens. I'll get more into that. The program is a professional program. It has a strong focus on health systems leadership and transformation. It is accessible. We address EDI concerns. We are about our student, faculty, people wellness, and we're really trying to build a community of people that are going to be able to move precision health forward. What we're looking to build with our students and through our program is a transdisciplinary community around the globe where people are interested in learning and conversations around health system challenges, improvements, innovations, and tools. Very, very often with a precision focus, sometimes not with a specific precision focus. We are interested in health systems challenges, changes, improvements, and innovations. We definitely see people and families, patients, families, people, caregivers, citizens at the center of our shared vision to promote wellness and improve the quality of healthcare delivery. We are a program that believes strongly in co-production of medical education, which means that we do work with patients and citizens in our courses and increasingly in other aspects of our program and curriculum development to make sure that what we're doing is in line with what people and patients also think is important for their healthcare system. And overall, our mission is to inspire a vibrant, curious, adaptable, supportive group of clinicians and practitioners and innovators and entrepreneurial thinkers, leaders, and agents of change. We know that healthcare transformation is a collaborative process. And if our program is to help advance precision health and transform our health system, this collaborative, supportive community is critical to moving this forward. And it's a really core goal for us in our program. So a few program highlights before I get into the details of the program. We are a fully online program aimed at working professionals. We do have some optional in-person events. We try to make those as hybrid as possible. All of our courses, however, are fully online. Our courses run September to June. Summers are off. You'll learn about how many classes you take per term as we move forward to the presentation. But we know working professionals sometimes need their summers off because people have a lot on their plates. We know that through our program, students can and will gain experience in this emerging transdisciplinary field of precision, but also health system transformation. Our students are able to network with thought leaders, experts, and peers, because as Ivy said at the beginning, our students come often with deep experience of their own, and that peer-to-peer experience is really important. Through our program, students develop practical skills for healthcare systems, change, improvement, and transformation. We have lots of opportunities for cross-specialization work. As I said before, focus on leadership. We are partnered with the Canadian College of Health Leaders, CCHL, and through our program, you can get a jump start on obtaining a professional designation, which is the Certified Health Executive Credential, which is recognized across Canada and increasingly recognized in other countries as well. And if you go through the master's program, one of the key applied pieces of our program is a community project with a partner of your choosing. And I will talk a little bit about that as we go forward. Actually, I'll talk about it now. The master's program, which is the third or second year of our program, depending which pathway you take, our master's students do a customized experiential learning project with a community partner. And what we find with many of our students is they come to our program in the hopes of maybe learning more to advance their own career or sometimes making a career shift. And what we've been able to do with our current cohort of master students is custom design quite strategic experiential learning projects for them in their master's year. We have students working with Alberta Health Services, with a number of University of Calgary researchers, and with some different startups in Canada and internationally. Phenome Health is one of our key partners based in the States. My point in bringing this up is if you progress through the master's program, and if you progress to the master's component of our Precision Health program, this experiential learning community partnership is a really great way to be strategic about where you want to take your degree once you get your program credentials. So keep that in mind. In addition to our experiential learning partners and projects that happen where you're actually able to apply the technical skills you learn in your program, you also get to apply many of the non-technical, I was going to say the word soft skills, but I don't like that word, the non-technical skills that are critically important for the healthcare future, healthcare workforce of the future. Let me talk about this for a little bit. We know that as we move forward as healthcare continues to evolve, there's a set of skills that are really critical for our future healthcare workforce. And the future healthcare workforce is that workforce that not only gives clinical treatments to people or who manages the system. This is the workforce that will transform healthcare, that will introduce new ideas, that will improve quality and safety. This workforce needs to have skills around managing very complex projects and tasks and very strong analytical skills. They need excellent interpersonal skills around communication, interprofessional teamwork, collaborative decision-making, social cultural sensitivity. They also need lots of skills that will help support and build positive work cultures. We know that our healthcare workforce has had a challenging few years during the pandemic and since, as we're trying to play catch up. It's really critical for our future healthcare leaders to be able to build a strong culture and a positive work culture moving forward. I'm not going to get into a lot of details here, but many of these identified essential healthcare employability skills are embedded in our program. So you, through the program work, through the community partnership, through working across specializations, have a chance to really build these additional healthcare employability skills. And the wonderful team of program instructors that teaches our courses, engages with students, and aside from students is the core of our program. I just have a snapshot of these people here, some of our instructors. Our instructors are a mix of academic faculty and expert practitioners. So we try very much to balance the academic world and the practice world in our program. And every specialization has a mix of practitioners and scholar, academic researcher, teachers as part of the program. So it's a really great group of people. All right, it's a bit of a high-level overview. So let's look a bit at the program options, and then we'll talk about the 4 specializations you have. So by program options, the first thing we always ask students that are interested in the Precision Health program is, do you want to do part-time or full-time study? Initially, our program was designed as a fully part-time program, a laddered program where you, in year 1, work towards a graduate certificate, in year 2, work towards a graduate diploma, and in year 3, completed your master's degree. You received 3 parchments, the certificate, the diploma, and the degree, and each built upon the next. So this was our original program option for the Precision Health program for all specializations. Over the past couple of years, we've had a number of students ask us, can I be full-time? Can I compress and just go directly into the master's and complete my master's in 2 years? And so now we are pleased to say, yes, you can. The second program option we have for students who want to be full-time is to go directly into the master's and complete a 2-year master's. If you choose this full-time program option, you do not receive a grad certificate or a graduate diploma. You just go straight into our master's program, but you complete in 2 years. I'll give you a quick comparison of what these 2 program options mean if you're considering which one would be best for you. So the option 1, part-time ladder program, option 2, full-time master's program. There's a difference in time commitment between these 2 programs. The part-time ladder program is really designed for working professionals who can dedicate about 10 to 12 hours per week on their courses. The full-time master's program is more suited to students who can dedicate 20 plus hours a week. This is a more demanding program time-wise, and potentially for those who want to be able to access student loans. The full-time master's program is set up so that you are a full-time student and you can access student loans. The number of courses you take in the part-time laddered program is basically 1 class per term, winter, fall, winter, and spring, plus a block week course in the 1st and 2nd years. If you're doing the full-time master's program, it is 2 to 3 courses per term, which can be just a higher load in terms of time commitment, which is why we've identified that. Student loans, again, some terms you might have eligibility for student loans in the part-time program. In the full-time master's program, every term you are eligible for student loans. As I said, in terms of the options, in the part-time ladder, you have an option to earn one or all three parchments, the certificate, the diploma, and the master's. And in the full-time master's program, there's really not an option. You just go directly in and you're earning your master's parchment degree when you go through there. The delivery model is the same for both. It's the same courses for both. It's just a matter of how quickly you're moving through them. And for the experiential learning community project, that happens in year 3 in the part-time ladder program and in year 2 in the full-time master's program. So I just noticed there's a couple of questions in chat. If you can pop them into the Q&A, as Ivy has mentioned, we'll address some of these questions at the end of the lecture. So again, just as a quick overview, the Ladders Mastered is where we started with this program, anticipating that most of our students would be working professionals who could dedicate that 10 to 12 hours a week on courses. The Ladders Masters gives you options to earn a certificate, continue on or step out of the program, move to the diploma, earn the diploma, continue on or step out of the program, and then go to the master's if you would like to do that. And we do know that for our full-time working professional students, this laddered approach really works well for them. But as I said, we were having requests for the full-time master's, so we do have a smaller cohort of students that are doing the full-time master's. If you need more personalized thinking about which would work for you, you are always welcome to reach out to us after this webinar and we can have some conversation. Okay, I am going to continue on to talk about the 4 specializations that are part of our program. So in our program, we have 4 specializations. And Ivy is going to pop up a Zoom poll right now just to see what specializations currently interest you. The 4 that we have available is Health Professions Education Leadership, Quality and Safety Leadership, Innovation and Entrepreneurship, and Precision Medicine. So I see the poll has popped up, so everybody who's listening, maybe just make a little note. Let's just see what people are actually interested in. And maybe we'll try to change your mind as we go forward here. And I actually see the numbers are falling out, Ivy and Ali, fairly similar to what we had in the last few years too. We do know that many people, especially our clinicians, come in with a precision medicine focus. I'm always going to pitch on the other 3, quality, safety, innovation, and health professions education as well, because we can have all the great clinicians and researchers and great new ideas coming out in the precision medicine world. You need the innovators to implement it. You need the quality and safety to integrate it within our system, and health professions education is critical too. Otherwise, we're not going to know, our clinicians are not going to know how to do the precision medicine approaches or precision health approaches that they want. So I love this, the distribution across the different specializations. That's great. As we go through the rest of this presentation, you'll learn a little bit more about each specialization, and you can give a bit more thought to which one might be the right fit for you. Okay, let's stop sharing that. All right, the first specialization we're going to go over, in no particular order, by the way. But the first specialization is Health Professions Education Leadership. So this specialization is really about becoming a leader in relation to how health professionals are educated about precision health and about other relevant topics. So this specialization really engages with questions like, how can our health education offerings and our curriculum keep pace with the rapidly changing world? As I mentioned earlier, precision health is really, really moving quickly. And how does our education, the education that we deliver to our health professionals, how does it actually keep up to it? That's one of the questions you engage with here. Another question is, how do you prepare our health professionals for those challenges and innovations that are coming quickly down the pipeline? How do you prepare them for the future? How do you make sure that they are able to rapidly seek, interpret, and use the knowledge that they're gaining in their clinical practice, in their managerial practice, whatever it happens to be? They talk about in this program what sort of practical evidence-based tools support health educators or organizational trainers, because education doesn't just happen in universities, it happens in many of our organizations. And A really big focus of this theme is how can our educational leaders promote capacity building, person-centered care, equity, and organizational change. So these are the kinds of questions that you would engage with if you are interested in the health professions, education, leadership, specialization. The next specialization I'm going to talk to is quality and safety leadership. For those of you who maybe have a background in healthcare, you know quality and safety is a big concern in our healthcare, and there are many, many opportunities to improve the quality and the safety of our existing service delivery models and approaches. And in this specialization, you're engaging with questions like, first off, what are the causes of quality and safety issues in healthcare? They tend to be very complex causes that you're going to learn actually how to explore what are the different causes. You're going to be talking about and learning about how the health system should respond when the outcomes that happen are not planned or desirable. You're going to be thinking about what is the science behind improving health systems, and there is a science behind improving health systems. So you'll be learning about that and applying it in the courses. And of course, you're going to be learning the management and analysis tools that can be used to do continuous quality and safety improvement in our healthcare worlds. Innovation and entrepreneurship is the third specialization. This specialization is really about how do I become a successful agent of change in the healthcare context? How do I bring new ideas, new processes, new technologies, new services into our existing healthcare system? It explores what it means to think entrepreneurially, to notice opportunities, to develop sustainable solutions. It explores what tools can be used to test and implement innovations within our public healthcare system. How do you design and deliver complex innovation projects? And for some students, how can I start a new venture to advance an innovation into our healthcare system? Whether that new venture is a social enterprise, a nonprofit organization, or a for-profit organization. In this specialization, we have students that are interested in starting a new venture and others that are interested in being entrepreneurial thinkers within the healthcare system. And finally, our precision medicine system. Our precision medicine specialization. So this is the specialization that really critically engages with the questions such as, what are those current and emerging technologies in precision health? How do these translate into clinical and health-related decision-making? What new tools and approaches offer real value to clinicians and to patients? What are the limitations of this fast-developing field of precision medicine? And who and what do I need to know to engage in future research development? Precision medicine is critical specialization within our program. What I will always say to people, and the reason we've designed the program the way we have, precision medicine in a silo won't necessarily move precision medicine innovations into our health organizations and into them in a way that will improve quality and safety, or in a way that will our health professions will know how to use the precision medicine innovations and changes, which is really critically why we have the 3 other specializations in our program. We see connections between them, and we increasingly are finding opportunities for our students to work together across specializations so that they can share what they're learning. So building on that, this cross-specialization collaboration is really important to our program. We've set up the program so that there are course-based opportunities to learn and work with students from other specializations. So the first course that happens in our program, MDPR 600, the Foundations of Precision Health, it is a block week course in August, so you need to be ready for that if you want to come into our program. This is your first opportunity to learn a deep dive across all the specializations and start meeting students from different specializations. In the second year of the laddered program and the first year of the master's program, you also take courses called MDPR 603, Health System Leadership, and 604, which is Managing Complex Projects. These are also courses where the full precision health student cohort for a year, they are in this class together. And these classes are designed for opportunities for students to work together. There's also opportunities to work together in our advanced topics courses, which are part of the master's program. The master's projects provide yet another opportunity to work cross-specialization. And of course, for most of these specializations, there is an opportunity to take your electives in other specializations. So lots and lots of opportunities to connect with students who are learning about precision from a different perspective. If you would like to know more about the specializations, we are going to host special webinars, special Zoom meetings with a deep dive into each of the specializations. So Dr. Ward Flemons, who runs quality and safety or leads quality and safety, his is April 1st or April 8th. Mine for INE Innovation Entrepreneurship is the 10th. HPEL is with Kenna Kelly Turner on April 11th, and Precision Med is with Dave Anderson, and that's on April 15th. So we will post some details into the chat should you want to attend one of these detailed sessions. I see Ivy's already put it into the chat. And we would highly encourage you to attend one of these more in-depth webinars about the specializations. And then if you still have additional questions, still pondering things, reach out to Ali. He'll talk about that a little bit more, and we can set up one-on-one meetings with either myself or one of the specialization leads if you're still having trouble about trying to figure out where you fit in our program. Okay, so that was a rapid overview of our full program and of the specializations that we offer in the program. What I'm going to do now is hand over to Ali, and he's going to run through a couple of slides that are more focused on how would you apply to the program, our program award, and some next steps. So Ali, if you're ready, I will hand over to you.
Thanks, Louise. Hi, everyone. So I'm excited to share some information about the admission requirements and program financials for our Precision Health program. Whether you are considering applying or you have already applied, understanding these details will help you to navigate the process effectively. Let's start with the admission requirements. So firstly, bachelor's degree is the basic required for the admission. This ensures that all applicants have the solid educational foundations to build upon. So in terms of documentations, there are several items you will need to submit. Your CV. So it's going to be comprehensively overview of your academic and professional backgrounds. It's very important. And if you have any voluntary job, I would suggest you to have it in your CV. And official transcripts from all previous institutions you have attended. And then we will require from you to submit the GPA calculations from each of those institutions you have attended, and a vision statement which outlines like your goals, aspirations for pursuing the Precision Health program, and how this Precision Health program is going to help you in the future. So that's very important to you put it in your statement, vision statement. We do require one extra documentation from international students, and that's the ELP requirement. So we have it in our website, so you can just check it out, which like exam you want to take, and then the score we required. And if you have any like questions on this, you can just reach out to me. And it is very important to note that our program do not require reference letters. So other programs they have, but our program doesn't require any reference letters. There is a self-assessment in our website. I would suggest you, like before applying, go there, do the self-assessment, see the requirements, and see if you are eligible for applying for the program. And if you have any of this stage, any questions you have, you can reach out to me, to the program email address. It's an under, we have it there. So you can just email me and then we can chat. So the next slide, we are going to talk about the program financials. This is the numbers I put it here is for this 2023-2024 year. So every year this changes, but it's not that much. It's just a slightly little bit different. So for this year, the tuition fee for Canadian students is $3,386 for 3 units. And then for international students, they pay around $6,732. And as Joe Louis explained that if you take a part-time option, you required to take 4 courses. So based off that, it means that the total cost for the Canadian students is around 13,546, and international students is 26,928. But there are some general fees added to this tuition fee, which is not that much because our program is online. So it's gonna be like $200-300 every semester. There's some general fees added to this tuition fee in total. Yeah, and then we do have, we want to talk about the next slide is about program awards, which lots of students, they are interested on this. I just wanted to highlight this, which is available for 1 to 1 students per specializations. So this award is based on financial need and self-identification as a member of an equity minority groups. So to apply for this award, you will need to submit a description of how your identity has impacted your educational journey and professional plans, as well as how completing professional education will support your aspirations. So the deadline for applying for the Precision Health Program Award is May 31st. So be sure to mark in your calendar. There is a form in our website and then the email address there. So you just fill out the form and then send it to that email address, which is the program email address. And again, if you have any questions or like any confusion on this, you can just reach out to me and we can even set up a meeting on Zoom or Teams. We can chat on this.
Okay, perfect. Thank you, Ali. Sorry about advancing your slides. Typically, my mouse finger got the best of me there. Wonderful. Okay, so that concludes our official portion of the webinar. I'll just bring up again some of those highlight dates, and then we'll open for some of the Q&A pieces. So our specialization sessions again are in April on a variety of dates. We schedule them each on a different date in case you would like to attend one or more of those sessions. We encourage people to apply early, simply because we do rolling admissions, and so we encourage people to apply early. We did used to have an early bird deadline, and we just kept that on this slide just to remind ourselves to tell you to apply early. So we're anticipating more applications this year. Our final deadline for applications is May 31st, and that means a complete application needs to be submitted by May 31st. All documents, all calculations, everything needs to be done by May 31st. Any questions that don't get answered in this session, please do reach out to us on our precisionhealthgrad@ucalgary.ca email. That's prehgrad@ucalgary.ca. And of course, for more information, you can go to our Precision Health website. There's plenty of information on there. Okay, Ivy, I'm going to, I know you've been looking through the questions. So Ivy, if you don't mind, I'm going to hand back over to you, and then you can field some of the questions and let Ali and I know which ones you would like us to answer, please.
That's great. Thank you. Thanks, Jo Louise, and thanks for everyone for sticking around. First question, can we switch specializations?
Well, I will take that. Yes, however, there is a bit of a timing issue if you decide you want to switch specializations. In particular, what will happen, each of the specializations has a set of courses that are required for that specialization. Most specializations have some electives. So if you start, for example, in precision medicine, and then you decide you want to go into innovation and entrepreneurship, you can use your precision med courses as your innovation and entrepreneurship elective. So for most of the specializations, we do have some room for you to choose a different specialization within that first term. The one exception, however, is quality and safety. Quality and safety specialization does not have extra electives. And so if you choose to move into quality and safety from another specialization, you can do that, but you might have to take an extra course or two depending on how far you are along the program. So it is fairly important to make a decision about what specialization you are primarily interested in. I would say after the block week foundations course, so you can make sure you are registered in the appropriate courses for the fall. If you have questions though, and are really torn between two specializations, I would suggest reaching out to Ali and myself, and we can make sure that you know when the last minute is that you need to make that choice, so you don't end up having to take extra courses. So I hope that answers your question.
There's one other question about specializations. Can we opt for more than one specialization, especially in the full-time master's route? Or can we do 2 specializations?
So again, it's going to come down to how many credits you want to graduate with, I think. And I'm going to ask Ali to jump in on this as well. To get a specialization, you really do have to have the core classes in that specialization plus electives from another specialization. So if you take extra courses, potentially you could do 2 specializations, certainly at the certificate year. It will get fairly demanding on your time though. So I would say for now, my recommendation would be to choose one specialization and progress with that. And then as you're getting used to the program, if you want to explore a second specialization, talk to Ali or I. But right now, I would really recommend focusing on one specialization. Ali, any focusing on one, using your electives to learn about the other specializations and using the opportunities for cross-specialization engagement to learn a little bit more about the different specializations. Ali, anything else on that?
I think, yeah, you just covered them. They only can have one specializations, but they can take other courses from other specializations as well, as you mentioned. So,
yeah. But on the transcripts, you really only have one, but you can take extra courses. Or on your parchment, you would only have one specialization listed on your parchment.
And let me see what we've got here. There was one other question about specializations. How many spots are available for each specialization?
That's a good question. I have to go back and I can't remember off the top of my head. Ali, do you remember?
Yes, yeah. So the minimum is like, because this is the online program, there is no limitation on that, but usually we go with like 20 for each specializations. Our aim is like having 20 to 25 students for each specialization per year. Yeah,
that's right. And then that actually works as well for our online format, because if you have too many people in a class, even though our courses are online, they require a fair bit of engagement with the students. And so if you have too many people on an online course, it's a little bit difficult to deliver the quality of course that we want to do. So that 25 is right. There are, however, a few classes that have lower enrollment caps, which is maybe a detail that will matter to you depending on which specializations or which courses you decide to take.
There's a question about the format of the block week course, and I think both Joe Louise and I can answer that. We're involved in that course. I wanted you to know that it consists of some interaction. So you're not in Zoom for full day classes. The course schedule is Monday to Friday, 9 a.m. to 4:30 p.m. But we've got sections of that where you are working on projects, you are working on presentations, you're working with groups. And so I just wanted you to know that you aren't going to be sitting in Zoom passive all week. It's a very interactive course. Jill Louise, do you have anything to add to that?
Yeah, that's the same for the block week course that I run in year 2 or 1, I guess, depending which program you're in, the complex project. The block week is, Monday to Friday or Tuesday to Saturday. But as Ivy mentioned, we do try to break it up. Sitting in Zoom for 8 hours a day is not at all fun. We do, however, encourage students to block that week off work as much as possible, because for both the course Ivy leads and the one that I lead, it is very intense. And so while you're not sitting in Zoom, you are working on the course for the bulk of that week. So we do encourage people to try to block it off as best they can from other obligations.
Great, thank you. And is there a maximum capacity of people in the program? How many students are usually in each program? So I think you described that with the specialization question. Overall, we right now have, I think it's around 110 students, is that right,
Yes.
Ali? And all across all 3 years. And so each cohort is roughly around 25 to 30 students. And you do get to interact, as Jill Louise was mentioning, with other students and other specializations. But right now the class sizes are really small, and so not really small, but they're small, so you get to know each other well and do a lot of networking.
Okay, perfect. Ollie, there's a couple of questions in the questions about GPA calculation. I'm wondering if you can just address those in the chat, or do you want to address those questions verbally?
I can, yeah. So there's we do have a job aid for the GPA calculations. There is a video. I just wanna post it here. It's very interestingly, this video has been done by AI, so it's very interesting. So and very useful actually. So each students, they need to do the this GPA calculations themselves and upload it. I just want to see what exactly they are asking.
So one question, Ali, was for those with MDs from Canadian schools with pass fail, how is GPA calculated for them?
Yeah, so we just look at if they have passed, and that's for med school. Usually we have our own like criteria we look at. But for others, we do the calculations, and then we just follow those ones. If it depends on the institutions they have studied. So
okay, perfect. Maybe I'll run through a couple of the other questions, Ivy. So there was a question on here earlier about, could the community partner project in the master's be aligned with the Royal College requirements? I would say yes. We are very attuned to helping students customize their community partnership project, experiential learning project in a way that helps support them best. We do have some students that are undertaking research as part of that final master's deliverable. We have students that are working with community partners on organizational priorities. We have a variety of different options for the community partner project. So I think the most important thing to know is we are experiential learning specialists. Her name is Lisa Frederick. She meets one-on-one with everybody, talks about what your career goals are, talks about what you need from the EL, and then we move forward there to try to design it. Somebody had asked a question, is there a way to speak with somebody or a grad that's completed the degree certificate? Very likely we could set up those kinds of conversations. If you would like, reach out to Ali and we will see what we can get set up that way. Somebody asked, if we choose to opt for part-time route but are able to take more courses per semester, can we complete the program in 2 years but still get the 3 certifications? Ali, what is the answer on that one? So if we choose to opt for part-time route, wanting to take the certificate, diploma, master's laddered approach, they're able to take more courses per semester. Can you still complete the program in 2 years but get the 3 certificates?
Well, they are allowed to take courses as much as they want, even if they are in the part-time base, so they can take. But this taking the courses has to be with the approval of the graduate program director and acceptance of an instructor. So they need to have these approvals from the GPD. So, and then they can take the course as much as they want. So, because this is a course-based program, so they can take courses.
Yeah, you can take the courses. Yeah. I would just caution on workload that we always want to talk to the students that want to try to fast track, because it is demanding and it is it's a heavy workload for the courses, especially if you're working full time. So as Ali said, if you wanted to do something like that and customize and speed things up and take extra classes, we would have a conversation with you just to make sure that it's going to work well. Erica has a question. Looking at the course schedule, looks like full-time program is a specific time of day. So let me just overview on the courses. I think all of our courses, with the exception of maybe 2, are offered in the evenings and are offered virtually. So they would start somewhere between 4 p.m. and 5 p.m. and run for 3-hour chunks of time. Most courses are 1 day a week for that 2.5 to 3 hour chunk of time. And in the evenings, except for 1 class, I think, is offered more during the day. We do that because we know most of our students are working professionals. So we've purposely moved the courses into the evening. As I mentioned, it is all virtual. Many instructors record their class sessions for students to refer to later, although we definitely encourage attendance and participation in the classes, and some instructors do have a participation component to the evaluation. So that, I think, takes care of the course schedule question.
There was a question about, is there a block week course later in the year? So the answer to this depends on if you're taking the full-time or part-time program. If you're taking the part-time program, yes, in year 2, there is a winter block week course in the first week of January. If you are taking the full-time program, again, yes, there is a winter term block week course, and that's in the first year, isn't it? Yes, in the first year. So there's 2 block week courses in the first year, 1 in fall and 1 in winter. And I think a couple of people had problems with the file uploaded in chat. So if you do, I posted my email address in the chat there. Feel free to email me and I will send you those files directly.
Okay. And Ali, just clarifying the cost, it is about $13,000 per year. So that's per year. So across a 3-year program, it's about $40,000 total.
Yes, that is correct. I was going to answer that one, but yes.
Oh, okay. Thanks. Perfect. Right. I'm just scanning through the questions that have not been answered yet. I'm going to get that one.
And there's one, Ali, as well, about if an international student has had all education in the English language, including a master's degree, will they still need to submit proof of English language proficiency? And I think that's no.
No, you do not need, you do not need to send any documents on it if you have finished.
Perfect. And will an international student need a study permit? You know the answer to that, Ali?
If they come to Canada, they need a study permit, which runs with the government. So it's but because this program is online and part-time, sometimes students, they can't get a visa because of this. So they are not eligible to apply for a visa. But if they could get it, they need a study permit to come to Canada and study here. But this is online program, so international students, they are not eligible to apply for a visa. We do have an international student center at the University of Calgary. I would suggest you, if you have any questions, specific questions on a study permit or work permit, you can contact with them. I will put the email address for them on the chat, but you can send the email to them. Even they meet with the students on Zoom and on Teams online and give advice to them how to apply and what are the requirements and eligibility for the study permit and visa.
Wonderful, thanks so much. And I'm noticing Erica's question as well. Looking at the course schedule, it looks like the full-time program is at a specific time of day. Is the part-time program asynchronous? No, it's just that I only added the times of the classes to that second page. So the time is the same for those courses. So please just refer to the second page for the days and times of those classes. They remain the same, whether you are in the part-time or the full-time program. So that means that some of the students in your class will be in the part-time program and some will be in the full-time program. And if that's not clear, just you can send me a question about that over email. Ellie, there was one other question about the GPA form. Does it need to be filled out separately for each institution or one form combined for all grades?
We do require for each institution's separate calculations. So, yeah. And then if you had an issue with the uploading those documents, you just send me email and then those documents, I will upload it for you.
Okay, wonderful. I'm just keeping an eye on the time because we have about 2 minutes left. We had lots of questions, so that was really, really great. Just want to reiterate to everybody, when you'll get a recording of this, when we will send this recording out to everybody who registered for this webinar, whether they were able to attend or not. If you have any questions about our Precision Health program, please check out our Precision Health website, Precision Health program, University of Calgary, Cumming School of Medicine. If you type that into Google, you will come up to our website. It's the top hit, if not the top hit. You can reach out to us through that website. You can also email us directly at precisionhealthgrad@ucalgary.ca. So that's PREH grad@ucalgary.ca. So I want to thank you for attending our information webinar today. We hope to see many of you in our program this September. Well, actually it starts in August because of the August block week starts in August, the end of August. And if you do have any other questions, please do reach out to us. We are happy to connect and we are happy to get you the information you need and put you in contact with other people who can answer your questions and tell you about this really great transdisciplinary program. So thank you very much, everybody. And we appreciate you giving us your time over this lunch hour. Thank you.
Thank you. Take care. Have a great day.